Kerrie Carroll devoted her days to nursing neglected animals back to health.
Hi there, Lucky Star Sanctuary. We're on our way to pick up an alpaca and a sheep.
Kerrie was an amazing woman. The thing that I loved most about Kerrie was how much she cared.
But when she needed care from the New South Wales health system, it failed her. After battling poor mental health, she tried to take her own life in 2023. At Queanbeyan Hospital, staff were told it was the second suicide attempt she'd made in just over a week.
There had been enough red flags that Kerrie should have been given the time and the space for her to get the right treatment that she needed.
Her partner Clint says instead she was rushed through a mental health assessment in a short-staffed emergency department.
I didn't really feel that it was appropriate at that time. Didn't really feel that she was conscious enough to make informed choices. Kerrie was very heavily sedated at the time because of the medication that she had taken.
No psychiatrist was ever consulted during Kerrie Carroll's care. The hospital then failed to tell Clint when his partner was discharged, just 9 hours after her suicide attempt.
Outside the Queanbeyan Hospital, there is a bench on the right-hand side. That's where Kerrie was with the same drugs and medication that she'd OD'd on, with a bottle of water in her hand.
Within hours of going home, Kerrie took another overdose, which this time proved fatal. A serious adverse event review by New South Wales Health later found a litany of failures in her care. It found the mental health assessment was suboptimal and not comprehensive, which may have led to her premature discharge. And it found Kerrie Carroll was not actually fit for interview when she was assessed, concluding she had remained sedated during the mental health assessment.
It's a deep tragedy. Obviously, we send our sincerest condolences, but more than that, a commitment to reflect on the circumstances that led to her death and make sure that we're taking action to try and ensure that it never happens again.
Since Four Corners shone a light on the dire state of the New South Wales mental health system, the ABC's been contacted by many more families with stories strikingly similar to Kerrie Carroll's. The state's been struggling with a serious shortage of public psychiatrists and spends the lowest per capita in the country on mental health.
The last budget, $2.9 billion, was the most we've ever spent, and I don't want to give away all of the details of the budget next week, but that's a direction that we're going to continue to move in.
Clint Seares is now taking legal action against New South Wales Health, but hopes sharing Kerrie's story will bring desperately needed change.
We keep on making the same errors and disastrous results because we fail to learn. Well, New South Wales Health is failing to learn. And if, you know, how many more people have to die like Kerrie before they're prepared to do something about it?
Sarah Garathy, ABC News.
And if you or someone you know needs help, please contact Beyond Blue by phone or through their website. Or if you're experiencing distress, please contact Lifeline on 13 11 14.